Welcome to Reframed, a podcast created to educate, encourage, and inspire parents and professionals. The Gladney Center for Adoption staff know parenting a child that has a history of loss, abuse, neglect, or trauma requires parenting skills and insight to be reframed in order to create a loving and caring environment. Reframed host Emily Moorhead and guests strive to make an impact on our world through topics that are important to you, your family, and our communities. And now, here's your host, Emily Moorhead.
Hi, and thanks for joining us for another episode of Reframed. I have two friends here with us today to have a conversation about the teenage brain. I have Dr. Connie Avila and Ashley Scott, and they're going to introduce themselves to us today. So tell me about you guys.
Hi, I'm Connie Siciliano Avila. I'm a licensed psychologist and a licensed professional counselor supervisor, and I have a private practice called Mind Sprouts Personal Growth Therapy, and I work with trauma, addiction, and relationships, and typically I see adults and adolescents.
Tell me about you, Ashley.
Hi, Emily. Thanks for having us.
Yeah.
My name is Ashley Scott, and I own a practice in Addison. It's called North Dallas Counseling Group, and I have a co-owner with me. Her name is Caitlin Schroet, and she also takes the same similar patients that I do. I work with children and adolescents, and I am a licensed professional counselor who focuses on play therapy, and I'm also a registered play therapist.
Awesome. So talk to me about the mysterious teenage brain. We have so many parents and professionals who are in the trenches with parenting and working with teenagers. So tell me, what do we need to know about caring for a teenager and helping them become resilient?
Sure, I'll jump into it. So the teenage brain is something that people often feel overwhelmed by and maybe unfamiliar with what's going on, and that's okay, that's common. There's just a lot of restructuring that's happening at this time. Synaptic pruning, myelination, which is a process of taking out the old and keeping the good, the new, that is going to be functional and helpful. And so while this happens, it just cleans out almost like you would clean out your garden beds to keep what is good and to get rid of what is not used. And so it's much like that of children at the age of like 2 and 3. This happens again in adolescence. And so it's a rebuilding process of their brain.
And there's so many hormones and peer pressure and just some really scary things going on for them during this pruning of that garden. And so that can be a really scary time for parenting a child who's vulnerable to those things. Tell me what we need to know about teenagers with addiction and how to be aware of providing them structure and guidance, but without helicopter parenting them.
So helicopter parenting, that's, I guess it's that task of learning how to do both, right? How to supervise and monitor as well as support their independence and not put too much on them, your expectations of who they're supposed to be, but allowing them to become them, their own identity. And their identity is in so many ways, in terms of like their sexual orientation, their religious beliefs, their political beliefs, what do they want to do for a career, and their interests in general. And I think sometimes as parents, we want to control all of that, and we want them to be what we want them to be. And I think the best way that parents can really be helpful to kids is to really sort of support their interests and what is sort of coming to the surface for who they are.
So is that almost coming alongside them? So I'm thinking about social media. That is so scary for parents. Your child is constantly on. There's constantly that peer pressure going on or that craving for adrenaline or chaos. And so how do our parents come alongside them with their interests or with even protecting them from some of these things that can be scary?
I know in my practice, and I'm sure Connie obviously feels this way too, the social media concept and topic comes up a lot because I think oftentimes as adults you might be plugged in and connected to certain things, but it's often not the same channels or avenues that the kiddos are plugged into. And so feeling just at a loss or unfamiliar And so what we like to educate on is just doing the research and really becoming familiar with what the apps are and making sure that you stay plugged into what is on your child's phone. What are they participating in, or their tablets, so that you are aware. And there is a difference between staying plugged in, being aware, and then of course helicoptering and, you know, being too involved, overly involved. But sometimes in this developmental stance and period, there's just a time where children really need the help and guidance in ways that sometimes they don't have the tools to ask for it. And so being the parent that's going to be plugged in, it allows for them to also have the accountability of, I'm here and I'm helping you.
Absolutely. I love that what you said too is that we have to be plugged in because sometimes they don't have the tools. What are some red flags for parents that their teenager may be struggling?
Well, I would say if they're starting to have behaviors at school, like if you're getting calls or contact from school, that's usually an indicator there's some sort of acting out behavior.
Okay.
If their grades are falling, if there's like a sudden change, maybe even in their personality. When we're talking about addictions, you know, I know we're talking about hormones and all, and there's changes and things happening, but if there's like drastic changes or they become very quiet, and some piece of that might be addiction, or it could be other things that are going on. If they're being bullied, if they're being harassed, you know, sexually harassed, the kids may be withdrawing and isolating. And so it's like looking at sort of the big picture and what do you know about your kid and how your kid normally is versus what's showing up, rather than sort of like dismissing, oh, they'll grow out of it or whatever. Like they might want to sit down and check it out with their kids. And I think one of the biggest pieces that is super important for parents is they can really learn to listen and be open to what their kids say, as opposed to if the kid actually takes a risk and discloses something and the parents have a negative reaction to it, then the kids are not going to turn to their parents. Ashley, you got thoughts on that?
Well, and I was just thinking back to the kind of plugging in piece. The parents that I work with often are overwhelmed by the ideas that they don't know a lot of things, and I think at some point that can be based on their responses, the judgment, the fear. Really, a lot of this is operating out of a place of fear, not knowing what's going on, not being familiar with the certain, again, channels and avenues of social media and things like that. And so I think a lot of it too, what I've seen that has been really beneficial and effective for parents is to not only stay plugged into the things that they're interested in, but also the people. And so if there's coaches, if there's tutors, if there are people that are spending a significant amount of time with your kiddos, make sure that you're listening to them too, because they are in fact professionals in a different way. You are absolutely a professional of your child, and you know them better than anyone, but oftentimes there are these other, you know, caveats that are relationships that they have powerful connections with, and they do often look at these people as, you know, trust individuals that they have and maintain these relationships with, and they are often sharing information that maybe they didn't feel comfortable with their family members. And so taking that not necessarily with a grain of salt, but thinking, oh wow, and also too plugging into other friends' parents and just different areas where you can explore and kind of research with other people who are in the trenches with you.
I love that. And so if a parent, if a coach, a mentor, if you notice there's something drastic going on in your kiddo, the red flags are popping, like we talked about, what's the next step for families? What can they do to protect their child? We don't want to go too extreme. We don't want to underestimate either. And so what does that look like?
Well, when you say to protect your child, can you be a little bit more specific?
Yeah, so if we have red flags going on with our kiddo, that there is some depression going on, that there's been a drastic behavioral shift, what do we need to do to further engage them and protect them?
So there's a lot of resources out there. I love the internet because you can get a lot of answers in a simple little Google search. There are professionals in the area. I love Psychology Today is a great tool to search for therapists. Also, if there's insurance, your insurance often will have lists of in-network providers. Reaching out to the community if you belong to a church. Also, there's nonprofit organizations that may offer like groups and that may help to get kids connected. Some of the things we talked about today during our presentation, we talked about connecting kids, especially if you have like a kid who is maybe identifying as lesbian or gay or bisexual. They may feel pretty isolated. And depending on the family dynamics too, it may be something difficult to talk about in the family. So you might connect them with some resources in the community where they can meet with other people, ask questions, learn, and maybe feel less alone.
Absolutely. You gave some screeners today, like a really easy online screener that parents can use, and we'll put that in our show notes because I think it's critical to have these tools in your toolbox and to know that they're accessible and available if you're starting to see some more risk factors, and always asking for help within your community or with a professional is really important. If our child struggles with suicidal ideation or has maybe even had a suicide attempt, is that always something that we need to fear for them, or is that a lifelong struggle for them, or is there different situations where it may not be?
I would say, it's not healthy for anybody to be operating on fear.
Sure.
Right? Because then you can become overprotective. But you definitely want to keep an eye on your child. You want to become aware of what does it look like for your child, if it's like depression, or if your child is diagnosed with something like bipolar disorder. Being aware of what that looks like in your kid, because it doesn't always look the same kid to kid. Mm-hmm. And also, again, keeping lines of communication open, having safety plans in place so that your kid understands what they might need to do to get help, or how they could do it to reach out for help. Mm-hmm. And that would also help the parents to say, hey, I see that you've been isolating in your room and you haven't been going out with your friends. And, when we ask you about how's school, you're really not talking. Like, maybe these are the signs for their child, and be able to say, it seems like maybe you're starting to feel depressed. Maybe it's time let's get back in with a therapist, or maybe we need to schedule an appointment if they're on antidepressants. Schedule an appointment with the doctor and follow up. And let's, review again. If you start to feel this way, let me know so that we can keep you safe. And constantly talking about keeping you safe. I don't mean constantly, but if it's an adolescent and they've already attempted, they're still not a full-grown adult, and they're not, they're still quite impulsive, and so there is reason to be concerned, but at the same time, you don't want to be constantly in fear or hovering.
Sure, and I think even if they felt like you were fearful or hovering, that they would feel that anxiety and that tension in the home, which could trigger a lot of other things for them, and they would feel responsible even for that, which can be difficult for our kids.
And I think to pull on to what Connie is saying, I feel the message that you're communicating is just using additional professionals. So things, or individuals like psychiatrists. I know I often refer to neuropsychologists for extensive evaluations. And so when you're working with patients, oftentimes you can get a good understanding and a good feel, but I also know that I am not the end all be all. And so I definitely refer out for professionals who have extensive batteries to test for specific distorted thoughts and faulty thinking, and to measure really where we're at with this. And it's so refreshing to get these results back and to have information to kind of gauge what this type of kiddo is struggling with, where he's at or she's at on these scales, to kind of know what you're working with. Because if this is coming back very alarming and glaring as to long history of family depression, suicidality, and they're scary and dark in their assessments, then of course there's an understanding that you can have where that is actually a legitimate fear, and it's going to change the dynamic of how you work with this particular kiddo in therapy and within the recommendations that you make for a family. Now, if this is situationally speaking, not to minimize it, it obviously changes the way in which you can encourage parents, and it just gives you more information, more results.
I'm hearing so much from both of you to stay connected, and just knowing your own child, that there are traditional red flags, but knowing your child and knowing they're normal and what's typical for them, that is huge, because that's when as parents, we can have that gut reaction of, oh, this might not be one of the traditional symptoms, but this is something it's completely not typical for our family dynamic.
I would also encourage parents to really educate themselves about if their child actually has a specific disorder diagnosed, which typically something's going on, or a kid isn't suicidal. An average kid is not going to be suicidal, so typically something is going on, and parents really could benefit by educating as much as they can and figuring out how they can best support them. And I like the idea, that talking about getting the evals, because it also informs treatment plans and how you in therapy would help them. And two, having resources available when you do have to recommend that a child get more care than what can be provided by an outside outpatient therapist.
Absolutely. I think teenagers are just, their brains are so unique and they are so unique, and it's hard sometimes, the pressure of parenting a teen, because there are so many stressors. How do we empower our parents to just really dig into who they are as people? It's something that many parents that I know that are parenting teenagers really can enjoy, and can really enjoy this special time. What kind of tips do you guys have for parents on getting to know their teen and really bonding and attaching with them in this new phase of life?
I think Connie kind of mentioned earlier in regards to really listening, actively listening to what it is that they're showing interest in and that they're communicating as something that they want to become connected in. And as we know during this time that there's a lot of impulse control and less cognitive control being exhibited, I think it's helpful to have information on how we can pour into them in healthy ways so that they can get that dopamine pumped up in ways where they feel really good and experience the thrill-seeking, kind of the expectation that they want, while also being able to engage with them in a way where you're not just shutting it down because this isn't really what you want to do. Because sometimes in working with some of the parents that I see, it doesn't feel as comfortable, or I don't have time for that, or it's just really difficult and it's out of that comfort zone, but really becoming comfortable with what makes them tick.
Absolutely. What's your number one tip for parents of a teenager in their parenting journey?
I think I would just really encourage parents to self-examine in terms of what do they want for their kids. And most parents will say they want them to be happy and healthy and productive. And really the best way that's going to happen is allowing your kid to be themselves and not necessarily trying to be what you want them to be. And I think that's the best tip I can give for any parent. Take it or leave it.
Yeah.
And I think in addition to that, just really keeping those open lines of communication.
Awesome. Well, thank you guys so much for joining us today and having this very important discussion. I want to ask you all to share your business name, so if our viewers want to continue the conversation, that they can plug in with you.
So I can be reached at MindSprouts, MindSprouts, P for personal, T for therapy, G for growth. .com. I have a contact page, and it's a secure portal, so any message that gets sent is safely sent to my email.
Great. What about you, Ashley?
And you can reach me on my website at northdallascounselinggroup.com, or if you'd like, you can send us an email at info@northdallascounselinggroup.com.
Awesome. We'll put those resources for you today in your show notes, as well as the assessments and screeners that are recommended by our lovely guests. Thank you so much for joining in today for another episode of Reframed. We look forward to seeing you next time.
Thanks for listening to the Reframed podcast. Be sure to visit gladneyuniversity.org to access the show notes and discover upcoming trainings at Gladney University. We'd love your feedback, so please head to iTunes and rate, review, and subscribe. Until next time.